Before we get into the discussion, each one of our panelists will be introducing themselves briefly. And I'd like to say that Rebecca Acosta actually had a family emergency and is not here tonight, but we are going to include her in the discussion. She has so many valuable lessons to share. So I'd like to tell you a little bit about Rebecca, even though we are missing her tonight and thinking about her and her family. Rebecca Acosta is a board certified patient advocate, and she actually was Nevada's first board certified patient advocate, a certified community healthcare worker, and she's founder of A&J Patient Advocacy. And it's interesting, after a 15-year career in healthcare administration, she welcomed two children with complex medical conditions to her family. And so she spent the next several years navigating healthcare and education systems on their behalf. And those years really pushed her to create the place and support for the information that she now provides as part of her health advocacy service. She is also an adult survivor of childhood trauma, and we'll be talking a bit about her experience. And she also has some excellent resources, which will be included in a follow-up email so you can access them after this presentation. So next, I'd like to ask Lee Mullert if she can share what brought her today, what experiences brought her to join us today for this panel discussion. Lee?
Sure. I, while I'm fortunate not to suffer from clinical anxiety myself, I've had many clients and family members who have struggled with anxiety at various different levels. And I think I've seen it be so disabling that people have been unable to participate in everyday life functions, crippling to that extent. And in particular, in my practice, I've had clients who have missed important medical exams or tests or appointments or just been unable to push through those. And so I think, or particularly in my practice with young adults and adolescents, have seen exactly what we saw today as shown in this movie. And my heart hurt for them because I've seen how crippling it can be for them and how scary and how it made them feel so abnormal. And it's really not. It's something that so many go through. So it was very much something that I could relate to as somebody who's helped others try to get to where they need to be, including sometimes helping them find the professional providers that they need.
Fantastic. Thank you, Lee. Thanks for joining us today. Leanne Finch.
Hi, I'm Leanne Finch. I actually am not a patient advocate. I work as an occupational therapy assistant. I've been doing that for 15 years. And before that, I've worked in healthcare since I was a teenager. And so for the past 7 years, I have worked primarily within a secure inpatient setting. And I work primarily with adults and older adolescents. And I work with patients who have complex, persistent mental illness. So there is no part of my job where anxiety doesn't exist, unfortunately, within that setting. I'm very passionate about trauma-informed care and learning about how our life experiences change how we can function within our society. And really working with people to figure out what motivates them and what helps them kind of move forward with their treatment. Because again, when you work with people with that persistent mental illness, it's just functioning is hard for them to do. So a lot of things in this video are so routine for me that I forget that they're not routine for other people. So I was really glad we got to watch this again. It's such a great documentary. And working with people on getting back to the community and what does the community look like for them, and what skills do they not have, or what skills do they need to reestablish, is really a big area of focus that I work with people on. And then I myself also live with generalized anxiety disorder and PMDD. And so I have spent my adult life outside of my professional life teaching myself how to live with that and how to take control over my existence. And then I have two older children who I'm really hoping, like the documentary told us, I'm really hoping that I can help them approach life with a better toolbox than what I had. So then that way they can get through their own emotions and challenges as they move forward.
I think one thing that I
Right.
loved in thinking about, you know, my own experience, I don't have anxiety. People really do. And one thing, just reflecting on the movie was how important it is for friends, adults, peers to help name what is happening, helping that person identify kind of what's going on because so often we as parents or colleagues can brush off what is happening by something else. And so I'm hoping that Leanne and Lee, you can share a reflection from the movie. And I wanted to also bring up what Rebecca had shared in our speaker prep, which was especially for young children. She had this identifying language called double dip feelings, which I actually have been using that since we talked about it. And double dip feelings, I think it was based on a book maybe she had read, was feeling two ways at the same time. So maybe you're happy and angry and naming those things. And I just think that's just such a wonderful, wonderful concept. Um, Leanne, what was brought up in terms of reflecting on the movie for you?
I really liked how they talked about normalizing things and how when we talk about them, we can control them better, and they just help us to understand what is happening with us. The example of the father and daughter who were talking together again, I forgot to write their names down a second time, but when they were like sharing and just how like he admitted his lack of knowledge and his lack of ability to understand what she was going through, but it didn't matter, right? They got there, she got the help she needed, and then in the end they said they hope that they can prevent someone else from experiencing what they had to experience as a family.
Mhm. So, Lee, this is for you to start out and answer. How can someone tell if their colleague, child, friend, family member has generalized anxiety disorder versus just normal anxiety? I think all of us are feeling a lot of anxiety in the world at the moment. There's lots to think about, but how are these things separated?
First of all, it really is something that should be diagnosed by a professional. So let me just put that out there. None of us should be diagnosing anyone unless you are qualified to do so. But I think probably the first qualifier to say is if it's interfering with your ability to function in everyday life, the odds are pretty good that it's something that you should go see a professional and have them assess whether this is something more than just what everybody feels. And the woman who talked about it during the clinician who was really primarily featured in the film, I think did a pretty good job of explaining that. So most people feel some degree of nervousness at some point in time during their life. That's just happens to all of us in one way or another. But if it starts to really interfere with your ability to do things that you would normally do and to get past the logic that you know to be true, then there may be something a little bit more going on. And you may benefit from therapy, medication, a combination of the two. And it may just be a short-term thing, or it may be longer. So it's worth getting that evaluated. And I want to add one other thing in here, which is I think as someone who has a master's in counseling, even though I don't practice as a therapist, a lot of people don't realize what occupational therapists like Leanne do. They don't see why they have a role in mental health, and they're so important. So I think if nothing else, it's great to have someone like Leanne on this because they do play a really important role. And they're so used to them being, somebody who helps someone with a stroke learn how to use a fork again. And that's not really the same. It's a very important role in treatment for mental health.
Thank you, Lee. It
For
is
sure.
it's good to hear. We're a very tiny department in where I work, so we spend
And there's
most of
not
our
enough
day.
of you. There's not enough of you. You need a
Thank you.
clone.
And Leanne, you had some thoughts also about distinguishing between a disorder versus normal anxiety.
Yeah, so Lee wrapped it up really well, right? Like you professional and it's if we're getting away from those everyday things and then to kind of bounce off of that in occupational therapy, our kind of defining thing for each person is what is your role in life? So, and by that it means what are the things you are expected to carry out? So for a child, roles and like they kind of said in the movie as well is, what are their usual things they're supposed to be doing? What is expected of them? So as a child, your role is to be a participant in your household. It's to go to school. It's to participate in the activities you enjoy. So as soon as any of those things either change or you notice they're not engaging in them, that can be a good indicator of like, oh, maybe something's not quite the way it should be. And right. And then you go and you seek that professional help from whoever it happens to be from, whether it's your regular, medical doctor at first, or yeah, or it's to a therapy service.
And I thought it was really interesting in the movie, and this was brought up too in our previous conversation. It's interesting to see how the roles of parents and children kind of get interwoven in
Mm-hmm.
understanding and identifying anxiety and maybe some other general disorders there, because I think that we as parents often project what's happening with our children, and maybe we're explaining away what their behavior is, thinking about how that's reflecting on us. So, what what advice do you have in terms of sorting out people's roles? I think
Mm-hmm.
especially in the family or in the workplace, in identifying and being supportive of somebody who has general anxiety disorder.
Yeah, so I kind of like to give people ownership of themselves when we're doing OT related things. And if it's relating to anxiety, right? Every person knows kind of how they feel themselves, right? We know what feels good for ourselves. We know it feels uncomfortable for ourselves. And so, like, giving them the space to kind of own that and say, hey, maybe I'm noticing things aren't kind of how they used to be, or we moved into this new thing and it seems to be taking you a little bit more outside of yourself than it usually does, right? Because like as you age and progress, you're constantly meeting new milestones, and that's the expectation, right? As we age, we take more things on, our skills develop, and then at some point, you might notice that something got harder or something suddenly got resistive. And it was like, whoa, this is a new feeling for you, a new expression for you. So what does that mean? And where is it coming from? And then giving them that space to say it with whatever words they have at their disposal and believing those words that they're telling you.
What are the most useful things someone can say or do to help someone with anxiety? Lee, do you want to go ahead and take that
Well,
one on first?
well, don't just tell them to calm down. That would be the first, that would be the first thing. I mean, I think acknowledging that someone is feeling anxious is important, and saying, I can see or hear that you may be feeling some anxiety. Um, and depending on the circumstance, like for example, I think it's different if someone is just feeling anxious versus if they're feeling panic. If they're entering into a panic attack situation. And one of the things I loved about the movie was how they talked about the amygdala and how it basically shuts off your ability to process things logically. And that's a really important thing. It takes, I think, 20 minutes for the pathways to open up again so that the prefrontal cortex can begin to work again and begin to process logically. And that's an important thing to know. If someone is really totally functioning only in their amygdala and panicking, they can't actually hear you when you're trying to talk to them in a logical way. You have to give them the opportunity to relax, give them an opportunity to calm down without saying calm down. And so frequently that means to do something like help them to breathe, give them an activity that will help them to get out of their head for a minute, whether it's one of the, the hands doing this, or I often have them focus on my eyes and breathe with me. Um, just long enough to help them focus on something else. Breathing is really important, actually. So something that will help them to reduce the stress, get the amygdala to calm down for a little bit, long enough so that we can have a conversation about what caused that increase in anxiety, get them to a different place and allow them to move on to wherever it is that they're trying to move on to.
I loved the example in the movie when they went to the retail store, and she was asking the gentleman at certain points, what's his number?
Stress level, right?
What's his stress level? Because that's a really easy kind of way to get somebody to maybe bump out of that for a minute.
Yeah, very good way.
Yeah. How would you answer that question?
I would say, yeah, it's a lot of, like you were saying, Lee, it's just like getting them to do something else, right? It's getting out of your brain and that thought spiral and into your body, into something else that's going on. I really like the example, like when they were like, do something with your hands. I know some people will like squeeze a stress ball or throw a ball back and forth, or any kind of movements like that. And then also using yourself as a tool in that situation, right? You can't tell someone to calm down because, well, do you know that's not going to work? As a person with anxiety who's had people tell me to calm down my whole life, it never works ever. I don't think it's ever worked. So I like to kind of mirror behavior you'd like to see in them. So it's being calm in your body, right? You can't control that other person. You can't control the person who's having anxiety. You can't snap your fingers and make them feel better, but you can try and bring the things that you're trying to share with them in yourself, right? It's having a calm posture. It's breathing calmly yourself. It's not allowing your own kind of body language to mimic theirs, because we're social creatures, right? Like we like to feed off of each other. We like to give that feedback constantly, but to stop and go, I can demonstrate what I'm looking for, right? I can bring that calm to this situation. I can't force them to be calm, but I can be a version of that for them. So that's what I think is important.
Yeah, that's great. And I remember when we were talking about this in speaker prep, Rebecca specifically said she was like, I'm going to take this in a different tact and talk about what you don't do. So what her advice is never to minimize, compare, or one up, um, but to acknowledge it, help name it, ask for help, and to teach young children how to, at a very young age, to control breathing. And we saw that in the movie. She also suggests triangle breathing, belly breathing, box breathing. There's actually a breath expert who has joined our audience today, Dr. Brad Lichtenstein, who has the breath space. If anybody is interested to go to his weekly Thursday morning breath meditations. They're fantastic. I've been doing them since the pandemic. Thank you, Dr. Brad. Um, and she also talks about um, uh, that individuals with anxiety around medical treatment need reassurance. So, especially, thinking again about anxiety, medical trauma, and how those things present themselves, honesty, compassion, and kindness. And I think one of the things that the movie did a really nice job of reflecting was thinking about what is happening inside our own heads when we're interacting with someone who is going through something. And so I'd like to ask the panelists, what do you do if your colleague, friend, family member is clearly struggling with mental illness but won't talk about it?
Mm,
Yeah. So I can go if
go
that's
ahead.
okay. One of the things that you could do is just acknowledging perhaps that they seem to be struggling, right? We don't have to put a label on it. We don't have to call it something. It can just be like, hey, I notice you're having a hard time. And again, being that calm presence for them is really sometimes the most important thing. And then it's giving them that space to have those feelings, right? You can give them information as well, but sometimes that's not well received. And if the person doesn't even know that they're experiencing anxiety, or they themselves have a lot of negative connotation with anxiety, telling someone, oh, I think you have anxiety, is not going to help in that situation. It just won't.
Yeah.
Again, we could try all we want, but so it's just giving them that space to process through it. And I like the example in the movie of the one guy who is saying he has a friend who just asked him why, and that's all they do. They just say why. Why are you feeling this? Why? Until they get to the point where they're like, oh, that is right. It was just a fear and I was letting it spiral. And I thought that was a really great, simple tool that they had someone in their life who that's what they provided for them, was just saying why.
And what an amazing gift to be able to use in all aspects of your life.
Yeah.
Lee, how do you suggest people deal with friends, colleagues who are struggling but don't want to talk?
I can't even count the number of times I've either have run into this myself or had someone else ask me, "Can you please talk to so and so because?" Um, you know, I too would say you can't just go up to them and say, "I can tell that you have anxiety." That just doesn't work.
Mhm.
If it's someone who you're really close to, at least, I think the best that you can do, pretty similar to what Leanne said, is to say, "Look, you know, it feels to me like this is a difficult time for you. You seem to be stressed about something. I get involved with this kind of stuff a lot. Here's some things that have worked for me. If there's anything I can help you with, I'm here. Call me." And sometimes they do, and sometimes they don't. And I usually find that if it's bad enough, there's going to be a crisis at some point or another. And and at least they know that I'm here.
Yeah. And
Mhm.
maybe even just saying, I don't know if you're going through something right now,
Right,
but I'm feeling something, and just know that if there's ever a time
right,
that I can help, I'm here.
right.
Yeah.
Because
Mhm.
you cannot make someone seek or accept help if they don't
Hmm.
want it.
Hmm.
Mhm.
And even someone who is in therapy can't see something or accept
Mhm.
help if they don't want to see it or
Yeah.
accept it, even if they've been there for a long time, which is one of the reasons I'm not actively a therapist because I
Yeah.
don't have patience. But but that's I think the best you can do.
Yeah. And this
Mhm.
relates to a question that we have from the audience. Christy Tate asks what to do if someone who might need help with anxiety is very resistant. And Rebecca, actually, in our prep, said, there are so many forms of communications tools now that allow you to be relatively hands-off or one-sided. And her advocate brain always goes to, if somebody is resistant, not open, they probably need information. And that is one way to be supportive without, but also allowing that person to take control of their decision making. And so, communication tools, emails, might be helpful in this case. And again, just
Depends
sometimes
on the
asking,
person.
yeah, and sometimes just asking, are you okay? Might be really all that's needed. And then just don't talk for a while, just listen. Would be good. Um, so we do have a lot of questions from the audience. One is from Dr. Nicole Rochester. It's actually a board member of Health Advocate X, and she'd like the panelists to address how the use of social media impacts anxiety,
Um,
particularly among youth, and what are reasonable and sustained interventions.
I can, I mean, I can start with that one and say it definitely seems to have an impact. Um, I think Leanne's kids may be younger than mine, so she may have a more answer. But I think there's no question there is some data that shows that um, just the immediacy of
Mhm.
information and comparative information that shows kids what the others are doing, the pure comparison has increased the levels of anxiety among peers a lot. And I don't have the data in front of me right now, but there are uh, people who have done. There was a panel that I was involved with previously, and a, a a therapist who was involved with that talked about how some of the data that was up there showed that this had really heightened the levels of anxiety among younger people a great deal. And a lot of the treatment programs that I refer people to or know talk about how much more they've seen among young people because of social media. So I think that it has definitely shown a level of increase. The positive side is that it's also, when it's used well, shown them access to resources that can help them.
Yeah, I actually I can only speak of this from personal experience. So like Lee, I don't have any data right in front of me, and actually in the setting where I work, social media is completely prohibited. So we can't, so I don't ever work directly with that with my patients within the realm of mental health. Um, but I do have a lot of adolescent humans in my life who I care a lot for. And we personally, within my realm, having children who exhibit some signs of anxiety, we really have, that's one of the only things I'm a little bit more strict about with them is just what they're engaging in online. I myself play video games. I've been an online person most of my life, and my children are the same way. So we just have really open discussions about what we're encountering on the internet, and we have really open discussions about who we choose to engage with, and keeping our circle small, even though social media really encourages us to make our circle really big. Um, so we just, like I said, a lot of frank discussions about who we encounter online, and who we encounter is not the whole picture of anyone. Um, and I think having my children play video games and having me play video games with them is, we who we are online is not who we are all over the place, right? We are versions of ourselves within every version of the world we interact with. And so we have a lot of discussions about that. And I hope that has helped them. They both, my son actually thinks social media is the biggest waste of time ever. So I lucked out with him. I don't have to worry about it very much. But yeah, just having that and having limits around it, and being okay setting those limits with my
So
children, I feel like has been helpful.
how do you limit? I mean, I know we did it with our
Um,
kids, but they're grown now, so I
yeah.
think it's
We did
different
too, but
So
now.
they're grown now too.
yeah. So for us, it looks like your phone becomes a brick after 10:30 at night. And then it doesn't unbecome a brick until 5:30 in the morning. And so that means, um, So my daughter is an adult now, so I don't do that for her anymore. But my son, it looks like he has access to his phone calls all the time. He has access to text messages all the time, but he doesn't have access to websites, to social media, to Discord, to things like that. So it's we've and now that he's driving, like he can have access to his maps app all the time, right? Like I don't want my child who depends on his GPS to suddenly lose access to that because he worked one late night at work, so but yes, and again, having really open discussions about that and saying, hey, you are a developing human, your frontal lobe has not yet developed, you are not going to be able to make rational decisions if somebody puts you in a hard spot, so let's talk about it.
Mhm.
So, and we started those conversations like at 10 and 11, like we started them way before that start, like the puberty started in our house, because we like to be ahead of the game in my house if
Yeah,
we can be.
I think that's great. And putting it in terms of how your brain operates, like the
Hmm.
operating system, and normalizing how people can get in and out of their executive function or amygdala. Obviously not for little kids,
Yes.
but I think that that tends to normalize it, you know.
Yeah.
And
And
I'm
again, it
think
was never like to blame them, right? It's not
yeah.
saying like, oh, you can't have this because you're to blame. It's like you are growing and you are developing and you are learning. And again, social media, like you had said, Lee, is a great thing sometimes, right? Like there are so many resources out there. Like I send them to my kids all the time. I'll like find a resource online. I was like, oh my God, I love this. And I send it to them. So it's not all bad. We just have to be thoughtful about what we're engaging with.
Mhm. I love the recommendation from Angie Ingraham, who said she can't recommend enough putting her phone on she's put her phone on grayscale, and that has
Hmm.
reduced her screen time. I
At
never even,
10 o'clock at night, my phone goes on grayscale, and some nights I'm
wow,
like, I'm gonna stay online.
like,
It's nope. I give up and I go to bed.
Never thought of that.
Yep.
Uh, um, so Maggie Pheasant asks about EMDR and why that wasn't mentioned in terms of it's kind of a common use tapping. Does anybody want to respond to that, Lee or Leanne?
I can do that in the context, especially
Mhm.
of our trauma series.
Mhm.
Hmm.
I think EMDR, we have a whole series on trauma, which you can access through Health Advocate X. And that's really a very appropriate place for EMDR to be discussed. And I think we do discuss it in there. Um,
Yes, we
it
do.
it is a treatment that is used um, for trauma, not specifically though, just for anxiety. So it's not really an appropriate conversation to have, I think, in this venue, but anxiety is often one component. It not often, it's pretty much always a component of what happens when you've experienced trauma. So I hope that makes sense. Um, so this conversation has really been focused on anxiety, and not everyone who experiences anxiety would necessarily appropriately need EMDR as a treatment. But
Hmm.
if you experience trauma, sometimes EMDR is the right kind of treatment to use to treat that. But not always. It depends on what kind of trauma.
Depends the
Right,
person. I mean,
right,
it's interesting in one of our community conversations, somebody recommended the tapping app to me. This is just anecdotal, not based on
right.
medical information. And I
Hmm.
used it for grief relief, and it was very powerful.
Well, tapping
So
is different.
yeah.
Tapping is frequently used, I think, for
Hmm.
anxiety, but it's
Hmm.
not separate from EMDR. They're two
Hmm.
different things. And not speaking, I'm not really qualified as a clinician to say that, but I do know that tapping is often used for anxiety because, like some of those, actually, I think the little one of the boys in this kind of used tapping.
Hmm.
Um, so there is an app that just talks about tapping, but tapping is a very commonly used um, form of diversion, if you will,
Mhm.
to
Mhm.
help people who are trying to cope with anxiety. So, yeah, the tapping app in and of itself might be helpful for many people.
Mhm. Leanne, I want to go back to
Hope that answers
something.
the question.
I want to go back to something you had shared in our speaker prep in terms of
Mhm.
some of the things that you typically do with your clients when they
Mhm.
are experiencing an episode in terms of helping them get into their body. Can you talk a little bit
Mhm.
about that? And somebody also said, just would love to understand more how OTs work with patients with
Yeah.
anxiety. So I think that
I
directly
would love
relates. So
to. This is literally my favorite thing to talk about. Yeah. So one of the things that I get to do at work is I have been trained in biofeedback and specifically using biofeedback within the realm of processing our emotions. So biofeedback can be used for many things, just like OT can be used for many things. So in our setting, we specifically use it to kind of give hard information to mindfulness, right? Mindfulness has existed forever. Like it has been studied by cultures throughout time. And where I work, we have a lot of people who don't, like the gentleman in the movie was saying, if it's above the neck, we don't believe in it. And unfortunately, a lot of the patients I work with follow that mantra. And so
Mm.
I really like using biofeedback, which will lead to another topic I'll talk about in a moment. But it gives us that hard data that goes with mindfulness. We focus on being mindful in our breath and what our body is feeling. And when we do that, our heart rate slows down, our heart rate variability increases. And so that's the difference between how low our heart rate drops and how high our heart rate goes while we we use it while you're breathing, right? So when we breathe in, our heart rate goes up, and when we breathe out, our heart rate goes down. And eventually, when someone is relaxed and is in their calm, kind of focused brain, we notice that their heart rate will increase at the same rate that their breathing happens. So, as we have a
Mm.
pacer hooked up to them and we have a breathing belt around their waist and we have an oximeter on their finger, we'll notice that when you get calm, your heart rate goes up and then when you breathe out, your heart rate goes down at the exact same rate in which you are breathing. And everyone has their own set heart rate, I mean, breathing rate that causes their body to get into that the best. And so it's fascinating. And like I said, it's really nice to give that hard data to all the woohoo of being mindful, right? Like
So
I
can
love being
ordinary
mindful.
ordinary people figure that out? And how would you do that? Or do you need a professional
Yeah.
to, yeah.
So you can go through professionals who do this,
Mhm.
but there are actually a lot of even recently in the last couple of years, there are a lot more resources. I believe on my watch, I can check my heart rate variability. So if you see things that say HRV, that is tapping into your heart rate variability, which when it is at its greatest means you are calm. So it's not looking at how, like, when we're exercising and our heart rate goes way up consistently, it's looking at the ability for your heart rate to go up and then come back down in a nice repetitive pattern. So there is one of the things I was trained on in an app that's out there is called Inner Balance. And it's you pay for a sensor, and there are other ones out there that just happens to be the one that I am familiar with. But it
Is that
has an
part
app
of
and
heart
it's
math? Is that part of heart math?
um
Might
yes,
be. I think
inner balance is part of heart math, and I'm heart math
Okay.
certified. Yeah.
Okay. Gotcha.
So yeah, so that one is through
Hmm.
heart math. But there are other ones out there, and again,
Hmm.
they all kind of do the same thing, right? We're trying to get our body used to being in that calm state, and us even figuring out, for a lot of people, they don't know what that calm state feels like if they've been living for a long time, again,
Hmm.
working with adults who've experienced complex trauma, complex mental illness, untreated of either of those categories for a long time. they don't know what calm even feels like. So half the time, that's what I'm starting out with. It's just, what does this even look like for you? And then that leads to the other thing. Sorry, I'm really going to tangent
No, no,
here.
it's
we
perfect.
do we do a lot of work with attending to our interoceptive systems, and so your interoceptive system is your ability to interpret what your body's telling you, right? Do you have to go to the bathroom? Are you too warm? Are you too cold? Do Is your heart rate increasing? What does that mean? Am I exercising? Am I anxious? Um, am I nervous about something that I'm excited for? Right? Like we get all these signals from our body and then we figure out what they mean. And interoception is kind of working on when we do interception work, we're working on what systems are we not listening to enough and what systems are we listening to too much, which systems are yelling at us when they maybe it's not actually what our body's telling us is going on. And so working on, and they talked about a lot in this movie about that awareness of our bodies and what is our body trying to tell us and how sometimes it's easier to ignore those things. Yeah, so in my setting, we do a lot of that. We unfortunately are doing a lot of pediatric care for adults. We work a lot with adults who probably should have had OT services or other services, therapy services as children or adolescents, and then never received it. And so we're like backpedaling their systems to really simple structures and figuring out how to do that with adults without insulting them
So,
is
so
always
give
the
give
highlight.
us an yeah, give us an example of that because I'm
Yeah.
mhm.
So I'll try and think of one that's directly related to anxiety. I had a gentleman I worked with who has spent his entire adult life living with anxiety, and he now is in his late 50s. So whole life. He has lots of trauma, some chemical dependency history, and he walks like this. I don't know if everybody can see me, but like this is his go-to. He has a
Hmm.
hood
Up,
always up, his
yeah,
shoulders are always up, his body is rigid, his breathing is shallow, he's making no room in his chest to breathe. And we worked on relaxing. Like for him, it was, we did biofeedback, but even that was too hard for him. So it was just like, hey, do you notice your shoulders right now? Can you, can we implement some coping skills to get you to check in with your body? His wasn't even using a coping skill. It was just a, can we come up with something to get you to check in with your body? So then oh, this is anxiety for him. And so it was, and it was a lot of physical movement. We had to do a lot of like breathing with our arms. So when we breathed in, arms had to go up, and when he breathed out, arms had to come down because he just was so used to his body being anxious that he didn't know how to let it feel any other way. So that was a really big one for him. And then also, sometimes people who experience a lot of trauma aren't safe in their bodies. Sorry, we're going a little too much into trauma, but they can be closely related. But if you experience constant of something, your body adjusts to it, right? That is human behavior. And so when we spend all of our time ignoring our body signals because our body isn't a safe space, it's not telling us the right things, we're experiencing a lot of anxiety, we then start ignoring our body systems for whatever reason. So I'm going to give a personal example. When we were doing interoceptive training, I realized I completely ignore my body's indicators for thirst. I can't tell you why. It's not based on anything that I can think of. When they talked about core wounds and stuff, like it doesn't seem to have anything to do with that. But I often ignore my body's signals for thirst, and so I get migraines. And yeah, and so that's the thing for me that I have to go, oh, check in with your body. Is it thirsty? And I could, right now I am thirsty, and like I have to keep my water bottle right here at all times because I won't recognize it before I get too overwhelmed. So
yeah,
yeah,
great.
it's very
Yeah,
interesting.
very interesting
Mm-hmm.
example. Thank you.
Mm-hmm.
And I
Just
think,
to add one thing to what
yeah,
Liam was saying, if anyone's interested, I have a client who uses the Muse. Um,
Yes, thank you.
Muse, it's like a sort of a headband,
Hmm.
and she does biofeedback and uses the Mute system, and it helps hugely with anxiety for her.
Hmm.
So what is that? How do you spell that?
Muse, like Muse.
Oh,
Hmm.
okay. Oh,
Yeah.
interesting.
And then inner balance is just a like a little sensor that you hook onto your earlobe. And so when you have to pay for the sensor, but then the app is free. But the sensor, like it's kind of spendy, but I think they're valuable tools. So if it's something that you find helps you, I, I think they're a
And
worthy
it
investment.
basically it measures your breathing and your state of
Mhm.
calm and that
Yeah,
kind of
so
thing.
it purely uses your heart rate
Mhm.
variability. So it's
Mhm.
not we use a lot more equipment like in our like
Mhm.
sessions. But
Mhm.
yeah, this one is just really it's just a little clip. It goes on your ear and it keeps track of your heart rate. And then because when your heart rate starts to do that pattern, that is how you indicate that you are in that state of calm because your heart rate will only do that if you have calmed your body. So if you're distracted, if somebody has an exciting visit coming up at my workplace, like you can tell or they just got done having an argument with somebody on a unit and we leave the unit and we come down to do biofeedback and they're like, wow, I just can't get into it today. And I'm like, this is the day we should be doing it because
Yeah.
this is when we need to work on it. So yeah.
So I want to shift gears for a moment, and
Mhm.
I just want to make sure that we have a chance to talk about tips, skills, and tools to address the reality of anxiety when navigating health or healthcare, because that's obviously one of the things that we are all about is empowering people around how to make decisions and navigate care well. Um, Leanne, what specific techniques do you suggest be used, especially in navigating health and healthcare?
Yeah.
Leanne,
So oh
it's okay.
that's okay. We're very similar.
Yeah.
I
Um,
know.
I frequently, for myself and for the people I work with, we do a lot of like list making or keeping track of things. So then that way, when you're in the situation that you're going to find overwhelming, you're not trying to figure it all out. Um, and yeah, lists or an agenda are really helpful for people and kind of as you think of them. So it's whether it's a running log on your notes section in your phone, or if you have something, if you have a notebook or a planner, and just putting those things down ahead of time. So then that way, when you get to the appointment or if you do have that like anxiety around medical appointments, you can have it there and you don't have to try and think of everything at once, right? Because that other part of the brain kicks in and we just lose all that executive function sometimes. And then also, I have a twin who has a lot of complex medical things, and we've discovered that she needs to bring the appropriate person with her to her appointments because she tends to blase, it's fine, I did great. And then her husband, who's a wonderful human, is not a medical professional. So he and also infuriates her when she's at her appointments. So like we've learned very quickly, like find the person who can go to your appointments if you need a person to go with you to appointments and utilize that resource if you have it. So for my sister, it is myself or our mother goes with her to her appointments. If it's going to be a lot of things, we know that it's just better to have two people go. Um, so
Yeah.
yeah, that
Yeah,
was
that's
what we
great.
figured
And
out.
appreciate those specific examples. And that leads us, lead Lee, to a question about how healthcare advocates can specifically help patients. You know, what's their role and how can they
Mhm.
help people reduce their anxiety specifically?
Well, those were two very good health advocate answers, Leanne.
I feel like there's a lot of overlap between us, you guys.
Yeah.
I'm really figuring that out.
Be,
There's a
be prepared with some questions, and it's always good to have us with you, either in person or on the phone. So there's a couple of things that I do, depending on the particular situation. One is I try, if I can, to talk to if it's a new provider, to talk to the provider ahead of time, and make sure that the provider or their team, somebody from a clinical person from their team, and make sure that they're prepared and understand the client before we meet, so that they know what's going to be walking in their door, so that they're sensitive to that. Unless I really know that this practice is just a great practice for anyone who has any kind of anxiety or trauma or anything else like that and don't even need any kind of prep. But in general, even under those circumstances, I think it's always good for them to be prepared and understand what's happening. I did have one client where it just made her feel better. So sometimes giving them a sense of control is also good. And so, anytime you're anxious or anything like this, particularly in a medical situation where you already feel like you've lost some level of control, giving them a sense of control is always good. So her psychiatrist wrote a letter, about the fact that she has severe medical PTSD and anxiety. And we put it in her clinical record, in the medical system, so that it was there if anyone happened to look for it. And we also brought it with us to any appointment, so that we presented it as part of sort of check-in and said, would you please make sure that the provider, doctor, APN, whoever, gets this as part of our check-in process. So if it was a new provider, they always got that says she has this condition, blah, 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 blah. And it just, I think, sort of created a heightened level of awareness on the part of the team at that point in time. And then, especially if it was going to be any kind of procedure or anything in which I knew that her level of anxiety was going to be heightened, making sure that someone was physically there with her, not just me on the phone. It is actually, I had a good enough relationship with her that I could actually calm her down on the phone. But for a procedure where I knew that she was likely to be a lot more stressed out, I made sure that someone was physically going to be there with her if I couldn't be, who had the ability to calm her down. Not by saying calm down, but who knew the appropriate things to do, because sometimes things just got out of hand and she would go into a panic attack state, and they knew how to do the things that were necessary. And we had a few tricks in particular that we would do that would help to stabilize her.
Great. Thank you for that specificity. I wanted to pick up one question we haven't yet covered that Beth Dropert put out there was, how do adolescents access help without engaging their parents, and what are the resources? Good question.
And a little on the
Um,
state.
yeah. I've actually found that there are really great resources on TikTok and Instagram, and
There's that
finding,
social media thing.
was that?
There's that social media thing.
Right. It is. And like I have used social media for the benefit and for the education, because sometimes children don't want to talk to their parents. They can't talk to their parents, for whatever the reasons may be. They're not comfortable yet. It's not safe, are all valid, right? There's no validity that they need to meet for that. And yeah, just using, Therapy Jeff is one of my favorite Instagram, TikTok people. He's very practical. He does a lot for more towards adults, but like he talks about therapy and helping ourselves in really like humorous but straightforward ways that I really appreciate. So he's my go-to if I need to send somebody resources that I don't want to overwhelm them with, but just like, hey, by the way, here's what you mentioned the other day. And so that's kind of a good place to start
Mhm.
for me anyways. And I like his specifically, I like that he doesn't diagnose people. He is a therapist, but he's straight up, he's very honest, he's very blunt, and he's like, this, I am not your therapist. You need to get a therapist if you feel
Mhm.
like these things
Mhm.
are overwhelming you. you need to get a therapist, and don't use me as your get out of jail free card. Don't use me to intellectualize what's happening in your life. Like, he's very straightforward about that
Yeah.
in his presentation. So he's one of my favorite resources to give to people, and especially adolescents, right?
Well,
Because
I'm
social media
definitely
is
checking
king.
it out.
Hmm.
Definitely checking that out. So
Yeah.
one last question before we wrap up tonight. It's been such a great discussion. And we'll start with Lee. What is one thing you want audience members to know or think about related to managing anxiety as it relates to navigating health or the healthcare system?
Breathe. Seriously. I think there's really two things. One is breathe. Um, the best thing you can do for yourself is to stop and breathe. Because truly, breathing and just stopping and breathing, count to 4 when you inhale and count to 6 or 8 when you exhale is the best way to calm yourself down and before you walk in any door, um, and recognize that you got this. And then the second way is to be prepared when you walk in the door. No, I know what I'm doing. I know what I want. And here's my questions that I want answered. And I'm in charge of my body.
Yeah.
Thank you, Leon.
Yeah, I'm going to go straight off of yours, Lee. It is what level of preparedness helps you in finding that out, figuring out, because some people don't want to be over prepared because it might make them have more anxiety, I've discovered. And then, but yeah, what is prepared for you? Is it having your questions written down? Is it exploring options that might be on the table ahead of time, so that way when your doctor maybe brings something up, you can say, oh, what about this? And then accepting that feedback that they're hopefully going to give you about it, or why maybe they didn't mention it. So, yeah. And then again, just everything is temporary, right? This visit will be temporary. This moment is temporary, and don't let a moment overwhelm you, and breathe. Yeah, exactly.
Yeah,
Everything you
very.
said.
And I want to go back to what you said before, Leanne, which is bring somebody with you. It's
Yes. Yes.
always good to have somebody with you. Even if you're not anxious, it's always good to have somebody
Hmm.
with you. Because
Right.
when it's your own health, you never hear everything.
Yes.
That
Yep.
is true. Thank you
Yeah.
both. Thank you,
You can't
Lee. Thank
record it.
Thank you, Leanne. Thank you,
Hmm.
Rebecca. We're thinking of you. And I'd like to also thank the leader, Health Advocate X leader volunteers, especially Beth Droppert, who was the first person to find and lead us to this particular film, and Melinda Stewart as well, and helping to support and bring our panel together. We really appreciate you. You'll be having a follow-up survey that'll be coming your way. So please give us your feedback. Let us know what you want to see next. This is part of an annual screening of topics that you want to hear about. So let us know. So from all of us at Health Advocate X, good night. Thank you.